Go ahead, ma'am.
Good evening, everyone. I'm Dr. Parinaaz Parhar from Oasis Fertility, Secunderabad, and today I'm going to be talking about egg freezing. You can also call it your fertility insurance. So, first things first, why are we talking about this particular topic? The reason being because of late I've been getting a lot of requests where people have been actually asking about what is it all about, what does it involve, what's the procedure, what's the cost, and for how long can you really freeze your eggs. So I thought, why not cover it up in a Facebook Live and try to make it as simple as possible for all you people out there. So egg freezing is something which has really picked up, gained a lot of interest, especially because you have all these multinational companies like Facebook and Apple who are actually offering to give it as an employee benefit to their workers as a part of their insurance coverage. And why is everyone talking about egg freezing? Because, as we are all aware, we as ladies are faced with this problem of declining fertility because of our declining egg reserve. So, somewhere our biological clock is always there on our heads, it's always troubling us, it's always governing all our major life decisions once we are in our 30s. And egg freezing seems like quite a boon for all of us who are very career oriented and who feel that we're not really at that point in our careers where we can afford to start a family, but we are very acutely aware of the fact that, if we don't do it now, it might be too late. So today I'll be talking and explaining to you all about egg freezing, what you need to know about it. So what is egg freezing? So according to the Canadian Fertility and Andrology Society, way back in 2014, they said it's an option for women who are wishing to preserve their fertility in the face of anticipated decline. And this anticipated decline is something that we are expecting post an age of about 38 years. That's the reason why this is typically offered to women who are under 38 years of age who want to preserve the option of having healthy, genetically related children at a later date. Well, if it's too late in your life, you always have the option of going for either a donor egg cycle where you can use someone else's egg in order to form your babies, or even the option of an adoption. But if you're someone who would actually like to have the chance of having your own genetically related child in the future, egg freezing is a great option for you. Now, why are we really concerned? Why are we all talking about the biological clock and the fact that you should be considering this option before you are 38 years of age? The reason being that, as you can see from this wonderful graph out here, the fertility of a woman sharply declines post the age of 38 years. In fact, right from about 35 to 37 years, there is a sharp decline in the fertility. Simultaneously, there is a sharp increase in the spontaneous abortion rate as well post this age. So, this all is mainly the result of one simple physiological fact that we as women are born with a fixed number of eggs. Unlike men, where they produce sperms every single day, in ladies, once we are born, we are done. We are born with a fixed reserve, and we don't produce eggs as such throughout our life. So, from that same pool of eggs which we are born with, you keep on losing a couple of eggs every month. As a result, by the time you are about 35, your eggs are 35, they have also reached that age. As a result, their quality declines slowly because you have been losing eggs from that fixed pool. The number also declines, leading to a sharp decline in your fertility post 35 years of age. So, one of the chief benefits of going for the egg freezing option is that it gives you a possibility of becoming a genetic parent using your own frozen thawed eggs. This is another graph which is depicting the same fact that the risk of miscarriage because of the diminishing oocyte quality keeps on increasing post 35 years of age, and it is as high as about almost 75% once you reach about 45 years. Now, because of this fact, it is usually advisable if someone was to ask me what is the best age to try and cryopreserve your eggs, I would say it's in your early to mid 30s. Somewhere between 32 to 37 years of age is the best time to consider egg freezing because post that age, your egg quality and number both would have suffered. So the best age to go for egg freezing is between about 32 to 37 years. Also, if you freeze your eggs at this particular age, it really reduces the risk of having children with chromosomal abnormalities. Again, we can see in this graph out here that Down syndrome is one of those syndromes which most of us would be aware of. It's a condition where the child is born with certain mental abnormalities and a whole lot of cardiac defects and mental abnormalities. So the children with these particular problems, they are seen to be born more to ladies of advanced age. So once you can see here again in this graph, post 35 years of age, the risk of having a child with Down syndrome sharply increases. So by preserving your fertility before this age, before you are about 35, you will reduce also your risk of having a child with chromosomal abnormalities. In addition, it also gives you the luxury of postponing your fertility, of postponing your parenthood to a time where you are more adjusted in life to actually start a family. Because most of us are career oriented, we might not feel we are ready for starting a family at a particular age. We might feel that we've not reached the financial status where we would be comfortable in starting a family. Or for many of us, it might be a condition where we've not found the right partner yet. But yes, we are aware that time is not on our side. Our fertility is declining. So it's an excellent option for those ladies where you can freeze your eggs today. And tomorrow, when you're in the right place and time where you have the right partner, you can thaw your eggs then, form the embryos using that person's sperms, and go ahead and get the embryos transferred to result in a pregnancy when you are ready. And those embryos which would be born would be formed using the eggs which you had frozen, say about 4 or 5 years earlier. So they would be as young as you were when you first had your egg freezing done. So that's the whole point of egg freezing. Now, what are the steps which are involved in doing this procedure? So if anyone comes to me like, doctor, I am interested in getting my oocytes frozen, what are the steps? How do you go about it? So the first and foremost thing is that we have realized what's the best age. The best age would be about 32 to 37 years of age. Suppose if you have already gone past that age, is egg freezing still for you? Yes, you can consider egg freezing, but yes, the results would not be that high. The success rate would be limited by your age. And the second thing is because your reserve would also go down with increasing age, you might need more than one round of stimulation to get as many eggs to result in success if your age is more than about 37. So coming to the steps, what are the steps of egg freezing? So firstly, we would like to evaluate the ovarian reserve of a patient who is interested in going for an oocyte freezing. This is usually done with the help of hormonal test, which is a day 2 or 3 basal follicle stimulating hormone and E2 test. So this is a blood test which is done on the second day of the period. It can be done at any time of the day. You don't necessarily need to be fasting. It gives you a rough estimate about what to expect as far as your ovarian reserve is concerned. A more reliable test would be an anti-Mullerian hormone test, which is again a blood test. Now, this particular test does not need to be done on any given day of the cycle. You can do it any day of the month. It is not really affected by your fasting state. So AMH is a fairly good test to try and determine what is your ovarian reserve. In a normal lady, the ovarian reserve that you're expecting is somewhere between about 1.5 to 2.5 nanogram per ml. The next thing which you can do is a transvaginal ultrasound, which should ideally be done on the second or third day of the cycle, where you count how many antral follicles are there in the ovaries. The antral follicles are the small cystic spaces which are about 2 to 9 millimeters in size, and we do a sum total of how many antral follicles are there in both the ovaries. So a normal person would have somewhere between 10 to 15 antral follicle count. We would say that you have low reserve if your antral follicle count is less than 7. Sorry. So once we have determined your ovarian reserve, we would also be asking your history and finding out if you have any comorbidities or if you have any other conditions that we should be aware of. But roughly, once all this is done, we can go for the hormonal stimulation of the ovaries once your periods start. So hormonal stimulation preferably is usually started on day 2 or 3 of the menstrual cycle. So the patient would be advised to come to report to the clinic once their periods start. That's on day 1 of their cycle. And from the second or third day of the period, the patient would be required to take daily injections, say roughly for about 10 to 12 days, depending on your response. These injections can even be taken by the patient themselves if they are comfortable. They're usually taken on their abdomen or on their thigh. They are gonadotropin injections. and they're slightly painful, not much. You don't need to take leave from office or from work for them. It's just a timed injection usually which needs to be taken at a particular time of the day, and you can continue with your daily activities thereafter. Once you're done with about 12 to 13 days of injections, you would be called in between to get your scans done to monitor the growth of the follicles. And once the follicles are about 18 to 20 millimeters in size, then you will be given an injection which is called as a trigger injection in order to cause the maturation of the eggs. And then you will be subjected to something called as a transvaginal oocyte retrieval. This procedure is done roughly about 34 to 36 hours after your trigger shot. So the trigger injection is usually given at night so that your oocyte retrieval, in layman's term, your egg removal is done in the morning hours about 1.5 days after your trigger shot. Now this is done by a transvaginal route. That means through the vagina, the ultrasound probe is passed, which is fairly painless. You would be used to it because you would be having your ultrasound monitoring done by that route. And to this transvaginal probe, a needle is attached and you're given anesthesia. And under anesthesia, all these eggs are retrieved. Now, please understand that these are the eggs which have grown in a particular cycle. Just because I've done your oocyte retrieval doesn't mean that I've taken out all the eggs from your body. These eggs would have anyways got wasted that cycle. So instead of letting those eggs get wasted that cycle, we have let them grow and we have taken them out and we will be freezing them. So we will be taking out whatever such cystic spaces that we see on scan. This follicular fluid is usually found to contain the eggs. This is what a mature egg looks like. So this is the egg and this is the polar body. Presence of polar body is usually the sign of maturity of the eggs. Now, how many eggs am I really looking for? Ideally, a patient should be motivated to try and freeze at least about 15 to 20 eggs. That should be a good number for most of the patients. So on an average, about 15 to 20 oocytes is what we are looking at. If it's not possible to get as many in one go, maybe a patient might require more than one cycle of stimulation to do this. Once we take out these eggs, then these eggs are frozen in the laboratory using a procedure called as vitrification, which is basically ultra-rapid cooling. The eggs are rapidly cooled from about 37 degrees Celsius to about minus 196 degrees Celsius using cryoprotectants and frozen in liquid nitrogen in the laboratory. Now, what happens because of this freezing is that these cells are arrested in their metabolism at a particular cell stage, and they can be kept at this stage for years together. So once you freeze your oocytes, you're free to use them, say about 5 years later, 10 years later, as long as you are continuing the cryo renewal. So these eggs are actually loaded onto these devices called cryotops and then frozen in the liquid nitrogen and stored there. You can freeze them for up to 5 to 10 years. Once you're done with the egg retrieval, the doctor would be giving you some instructions about the medicines and all, and you would get your periods in a couple of days, and then you can go about your daily routine. No need to take any leave or anything post egg retrieval per se. Maybe on that particular day, you can take a day off. Now, what is the survival rate of these oocytes that we have stored using vitrification? So when we take them out, we have frozen the oocytes, we would be thawing them later for utilization. So the survival rate of oocytes after vitrification and thawing is usually about 90 to 97%. So if I have some 100 eggs frozen, about as many as 97 oocytes will survive this freezing and thawing. Now this number has drastically improved over the years as the vitrification technique has improved. Earlier, we used to do a technique called a slow freezing, and it used to be very difficult to actually freeze eggs. So the survival of eggs was not that good. So a lot of societies were saying that egg freezing is an experimental procedure. It's not giving very good success rate. But ever since we have vitrification being practiced since almost a decade now, it's given excellent success rates, and you have a survival rate of as good as 90 to 97% for oocytes, which is almost as good as embryo survival rate post freezing and thawing. Now, if you combine these oocytes with sperms, the fertilization rate is 71 to 79%, which is almost as good as a fresh oocyte. And the clinical pregnancy per vitrified and thawed oocyte is about 4.5 to 12%. So that's the reason why we say that you should try and get about 15 to 20 oocytes is a good number for the for freezing. Now, this is another graph which is showing the oocyte survival rate. Now, we spoke about the procedure. What are the medical risks associated with it? Is it an absolutely safe procedure? Well, given the current scenario and the current advancement in ART, oocyte freezing is a fairly safe procedure. The risks are fairly negligible, but yes, there are some known risks associated with it. One of the most common ones is ovarian hyperstimulation syndrome. So you have different kinds of hyperstimulation. You have mild to moderate ovarian hyperstimulation syndrome. Quite a few patients might complain of fatigue, nausea, headache, abdominal pain, breast tenderness, irritability, mainly because of the hormonal changes associated with the procedure. About 0.1 to 2% of the patients might complain of severe hyperstimulation syndrome, where they might complain of condition resulting in blood clots, shortness of breath, abdominal pain, dehydration, and vomiting. Now, again, we have advanced to a condition where it is an OHSS free clinic where hyperstimulation, thankfully, has become a thing of the past because of the current gonadotropin protocols. It's fairly safe, and we hardly see any patients suffering from the severe ovarian hyperstimulation. So rest assured, it's a fairly safe procedure nowadays because of the antagonist protocol and PPOS protocol. We have the flexibility of using a trigger injection other than HCG, and so hyperstimulation is a thing of the past, more or less. Now, a lot of patients will have this query whether ovarian stimulation may increase the risk of cancers. So the risks of cancers associated with IVF are fairly limited and conflicting. There has been a lot of research in this regard, and IVF is found to be a more or less a very safe procedure, and there hasn't been anything which has conclusively told us that increases the risk of any sort of cancer in a female. But yes, there are associated risks of IVF pregnancy, like the risk of multiple pregnancy, pregnancy-related hypertension, premature delivery, operative delivery, and having an infant born with no birth weight. Mind you, these are not the risks of IVF as such. These are the risks of the patients who are undergoing IVF. So usually, as you can understand, a patient who is going for oocyte cryopreservation is someone who is more than 35 years of age. Such a lady would anyways be at a higher risk of having a pregnancy. The pregnancy would be a high-risk pregnancy. So as a result of that, at an advanced stage, you tend to be at a higher risk of having high blood pressure, premature delivery, and other things. So I would rephrase this to not risks of IVF. I would say the risks of the age group in which we are helping the patients out using IVF. Now, because when you're doing oocyte freezing, you are actually the only way to have a pregnancy is via IVF. So, and because you are freezing the eggs to get them transferred as embryos at a later age, it is necessary to understand the medical risks of pregnancy at an advanced age. So yes, though you have the option of getting your embryos transferred, say about 5-10 years down the line, it is important to understand that the risk of a pregnancy increases as the mother's age increases. So similarly, as your fertility is declining, the risk of pregnancy is also increasing. So there's an increased risk of gestational diabetes, hypertension, cesarean delivery, and preterm delivery of a baby with low birth weight as the mother's age increases. So, however, these risks vary widely depending on the woman's health status and increase with maternal age at delivery. Now, another important question which a lot of patients would want to know is that what are the financial costs of social egg freezing? So, social egg freezing, if you were supposed to look at any of the Western countries, it would cost you somewhere about $25,000, $15,000. But in India, you can expect it to cost you around somewhere between about 1.5 lakhs to about 2.5 lakhs. It depends upon the kind of stimulation you undergo, the kind of drugs that you go for, but on an average, it would be about 2 to 2.5 lakhs. The procedure would mainly, it's not just about the cost of the egg freezing and the retrieval, it's also about the cost of renewing the cryopreservation, because once you freeze the eggs, you need to renew it every year. So that would roughly be about, on an average, say about 20 to 25,000 rupees per year. So it also depends, the cost also would depend on for how many eggs are you freezing and for how long are you freezing them. So, but on an average, it would be about 2 to 2.5 lakhs. But since it gives you so much of mental relief that yes, you have frozen, you have in a way frozen your fertility for future use, it is quite a good option. I think its price is pretty well justified. Another question that a lot of patients would have is, should I freeze eggs or should I freeze embryos? I would say please freeze your embryos if you are in a stable relationship, if you have a partner, and if you're not ready for parenthood right now. So rather than freezing your eggs, it would be better to freeze your embryos because embryos are the end product. With eggs, you don't know really that how many eggs you would really need to get the right number of embryos, and you don't know what is the quality of embryos which would finally form. Plus, still freezing and thawing of embryos has better results as compared to eggs. So if you're in a stable relationship, then it would be better that you freeze embryos versus freezing eggs. Well, this is all about social egg freezing. If you have any more questions about this, please feel free to drop them in the chat box and we will get back to you with the answers. I hope the session helped you all. Thank you. We already discussed about the side effects of this oocyte freezing. It's mainly concerned with, the main thing is hyperstimulation, but with the current drug protocols, it's fairly safe. We hardly see any severe hyperstimulation cases. So I would say it's a fairly safe procedure. Does egg freezing affect the child? No, there is no long-term effect on the child because of the freezing procedure per se. No, it's not known to really affect the child adversely. The risk of having a child with any sort of abnormality with IVF as such is almost the same as a natural pregnancy. How many eggs are frozen per cycle would actually depend upon how many eggs were retrieved. We would try to freeze as many as possible in one cycle. So the best number would be about 15 to 20. We'll try to get as many eggs out in one go. So the more the better. It all depends upon the ovarian reserve of the patient, how many eggs we see and how many we can stimulate in a particular cycle. Well, that's all for now, and thank you for your questions. Yeah, thank you.